because to replicate your experiments, where it will be better if you share your publications with all the participants. It will be quite beneficial.
Yes,
Thank you very much for your very excellent presentation. Now the session is open for question answer. I would request the participants to raise their questions, ask the speakers about their queries. Now floor is open for question answer.
We'll take compliments also, if you don't have any questions.
Well, Dr. Barry, I have a question for you. Please explain how you treat your patients through HOMA, the psychotherapist, the procedure. I will little bit just summarize how you treat the psycho patients through this HOMA techniques.
Yeah. Okay. Thank you. Nice question. There are basically three levels you might think of. Ideally, eventually, I will encourage my patients to do Agnihotra themselves. Of course, this ends up with me losing some of my business because, frankly, after some weeks or months of doing Agnihotra, they may not need my services. A second level, you might say, is my patients come to my office or sometimes to the Eco Village here. And even if they don't know that we do the fires, the fact that they're in this atmosphere makes every intervention that I may do with them more effective. And that's basically what it does. Now, we also have, my specialty is dealing with depression and drug addiction. And we actually have, and you can see it in detail on my website, homapsychotherapy.com, what's called the Homa Therapy Drug and Alcohol De-Addiction Program. And this, in a nutshell, requires the patient, the addict, to come to a Homa therapy center for minimum 3 months and to engage in daily Agnihotra, several hours a day of Om Trambakam Yajna, which we do here at Bhrigu Aranya, 5 hours daily and 24 hours on full moon and new moon, Amalsha. They do physical work. They do intense change of diet. If the addict is not a vegetarian, they become a vegetarian for those 3 months. If they are already vegetarian, they engage in a nearly 100% raw food diet, including fasting, juice fasts, 3 days of duration, maybe twice a month. Periods of Maun, silence, 1 day, 2 days, 3 days sometimes, all in an effort to break through the egotistical mind of the drug addict so that they go within and learn that their happiness is within and not through using drugs or alcohol. So this is, in a nutshell, how I use Homa psychotherapy with patients.
Okay, thank you. Thank you, Dr. Barry.
Welcome.
Well, participants, if you have any questions, queries, you can ask directly to Dr. Barry or Dr. Rory or Asiya Maher.
Good afternoon, everybody. Myself, Dr. Sunil Kumar Senapati. I have a question for Dr. Maher. Hello.
Hello, yes, please go ahead.
Okay, sir. You have a very good, nice presentation, which is very